Thank you very much, Mahmoud, for the nice introduction. Actually, this is a company symposium, and I will talk about one of the important ARPs we use every day is Tell Me Certain. This is the main points we are going to discuss today. The first will be the prevalence and burden of hypertension worldwide and in Egypt. The new European Society of Cardiology 2024 guidelines for the management of hypertension. We are going to discuss the definition, mechanism, and risk factors of nocturnal hypertension and the importance of treating such subtle part of hypertension. Association of nocturnal hypertension and cardiovascular events. Again, we'll go back to the new European Society of Cardiology guidelines 2024 for the management of nocturnal hypertension, and we will end with some discussion about the importance of Tell Me Certain in controlling 24-hour blood pressure and in cardiovascular protection. As regards the prevalence of hypertension, this is a common slide we used frequently, and we know that hypertension is the number one killer, is the number one leading cause of death worldwide, especially in low and middle income countries. And if we look at the rank of hypertension as regard one of the modifiable risk factors, we can find that in 1990, hypertension come as the first one cause of death worldwide. And in 2019, it's the same rank. Hypertension, again, is the number one killer, as we see here. And this is one of the important presidential initiatives done in Egypt is 1 million wellness. And we found that this data obtained from this 1 million wellness, that hypertension may contribute to 30% of total non-communicable disease risk factor prevalence in Egypt. That's to mean that in every 10 adults, Egyptian patients, we have 3 having hypertension. And also, 84% of the total deaths caused by the 4 main non-communicable disease, mainly heart disease, diabetes, cancer, and chronic lung disease, are the main cause of death. And also the 4 non-communicable diseases are responsible for 67% of premature deaths in Egypt. And all of us know what we mean by the circadian rhythm. And this is one of the studies that showed that myocardial infarction and stroke usually happens in the early morning at starting 6 a.m. till midday. Let's go to these important guidelines, European Society of Cardiology 2024 guidelines for the management of hypertension, and we have such a new classification into non-elevated, elevated, and hypertension. And they omit actually the normal or optimal blood pressure. Only non-elevated, elevated, and hypertension. And we mean by non-elevated blood pressure is a systolic blood pressure of less than 120, diastolic of less than 70. And elevated if we have a systolic blood pressure between 120 and 139, and diastolic blood pressure between 70 and 89. Hypertension is defined if the systolic blood pressure is 140 and more, and diastolic blood pressure is 90 and more. And again, they moved away from the term normal or optimal to emphasize that cardiovascular risk is continuous and not in a binary fashion. Actually, we don't know what is the normal reading of blood pressure, what we can define normal hypertension. That's why they moved away from term normal and optimal. And this is the equivalent blood pressure measurement office, home blood pressure, and ambulatory blood pressure. For non-elevated blood pressure, the definition of hypertension is the same for all. But for elevated blood pressure, it is 5 millimeter mercury less for home and ambulatory blood pressure for both systolic and diastolic in elevated blood pressure and hypertension. And this is one of the statements mentioned in European Society of Cardiology Guidelines 2024 that masked uncontrolled hypertension which occurs in 30% of patients treated for hypertension, is more often due to poorly controlled nocturnal blood pressure than daytime blood pressure. And again, nighttime blood pressure may provide more prognostic information, we'll show this later, than daytime blood pressure. Perhaps it is less dependent on physical activity. And again, in the new European Society of Cardiology Guidelines 2024, this is the algorithm for the treatment of hypertension, and they mention that patient with hypertension, we mean that patient with a systolic blood pressure of 140 or more, diastolic blood pressure of 90 or more. We have to start with low-dose dual combination therapy, and if the patient is not controlled, we have to move to a triple combination therapy in a single pill. This in contrary to the European Society of Hypertension Guidelines in 2023, that they mentioned that we have to go for dual therapy and then to up-titrate and then move to triple therapy. This is the difference between both European Society of Hypertension Guidelines 2023 and European Society of Cardiology 2024. And as we know that the main drugs used for the treatment of hypertension are mainly ACE, ARBs, calcium channel blocker, and thiazide or thiazide-like diuretics, as they mentioned here as a class 1 level of evidence, A, that among all blood pressure drugs, ACE inhibitors, ARBs, dihydropyridine calcium channel blocker, diuretic, have demonstrated the most effective reduction of blood pressure. Not only that, but also cardiovascular events reduction. That's why they come as a class 1 recommendation for the management of hypertension. Let's go rapidly through the definition of nocturnal hypertension and the pathophysiology of that if we have a nighttime blood pressure, a systolic nighttime blood pressure of more than 120 or a diastolic blood pressure of more than 70, this is what we call nocturnal hypertension. And this is the 4 pattern of dipping as regard hypertension, nocturnal hypertension. We have the physiologic dipping. The physiologic dipping, this means that the systolic blood pressure should be reduced by more than 10% up to 20% of the daytime blood pressure. The same for the diastolic blood pressure. We have the extreme dipping if the systolic blood pressure is reduced by more than 20% as compared to the daytime blood pressure. And we have the non-dippers or non-dipping if the systolic or diastolic blood pressure is reduced by less than 10% as compared to daytime blood pressure, and the risers or the reverse dipping if the blood pressure rise more than the daytime blood pressure in the night. And this is a prevalence of nocturnal hypertension. We can find that half of patients with hypertension have nocturnal hypertension, but it's most common in patients with chronic kidney disease. And this is the main pathophysiologic mechanism behind nocturnal hypertension: salt retention leading to fluid retention, activation of renin-angiotensin system, obesity, diabetes, Parkinson's disease, and aging, which will lead to sympathetic overactivity that will exacerbate the blood pressure dysregulation. Renal and cardiac dysfunction also will lead to volume overload, especially by night, that will cause nocturnal hypertension. And sleep disorder is very common cause of nocturnal hypertension, mainly obstructive sleep apnea. And this is the main association of nocturnal hypertension and the cardiovascular events. This is different studies. We'll not go through all of this, but we can find that nocturnal hypertension is associated with increased arterial stiffness and central blood pressure. And as we all know that central blood pressure is very important factor for hypertension-mediated organ damage. And in one of big meta-analysis, they found that nocturnal hypertension is associated with cardiac and carotid structural remodeling, especially increasing in left ventricular mass index and carotid intima media thickness. Also, it is associated with a lot of cardiovascular events, especially in patients with chronic kidney disease. And as we see here, nighttime blood pressure level and the rise pattern were independently associated with total cardiovascular events rate. This is a guideline recommendation for the management of nocturnal hypertension. It's very simple to say that we have to use drugs that cover the 24-hour as measured by ambulatory blood pressure. This is very important to use such a drug and to know which drug that able to reduce the blood pressure by night and cover the 24-hour blood pressure. Let's go rapidly through telmisartan, and this is one of the important slides. I'll go through all of this. Number one, it is rapidly absorbed, so it acts within half an hour. Number two, the bioavailability, 40% of this drug is available within half an hour, and volume of distribution is 500 liter. And the most important is the elimination half-life of the drug is about 24 hours. This means that it's a very long-acting drug. It even covers blood pressure beyond 24 hours. And also the affinity to AT1 receptor is very, very strongly attached to the AT1 receptor with slow dissociation from these receptors, explaining the long half-life of this important drug. And also the lipophilicity of the drug. Lipophilicity means that the penetration to the tissue is strong and it is very effective. And one of these important parts is the PPAR, the metabolic activity. It's very helpful in diabetic patients and patients with metabolic syndrome, as we will see. I will go to this last slide, that this is the main indications of telmisartan. If you want a cardiovascular protection, telmisartan will be the drug of choice. Will come number one, telmisartan. Sorry for this animation, it is not right, but for cardiovascular protection, again, telmisartan is a drug of choice. For myocardial infarction, valsartan is a drug of choice, followed by telmisartan. For stroke prevention, second choice is telmisartan. For atrial fibrillation, telmisartan is the first drug of choice. And for diabetic patients, as we mentioned before, because it has a PPAR effect, it helps in improving patients with diabetes. And also in patients with diabetic nephropathy, it comes as second choice after losartan. And in metabolic syndrome, also it's the drug of first choice. And these are the main indication of telmisartan, a lot of indication of this important drug. And this slide can summarize all of this. As a company, we need to have a different combination of the drug, because this will help us a lot to treat our patient either with a dual therapy in a single pill or a triple therapy in a single pill, because this will help our patient to be adherent to the treatment. Adherence is very, very important. Not only initiation of drug for our patient with hypertension is important, but also to keep our patient in such drugs are very important, and the availability of multiple combinations, whether dual or triple combination in a single pill, will help us and help our patients to be adherent to the treatment to protect our patient from these serious side effects of hypertension. Thank you for attention.